So this is a narrowband UVB unit that we use for medical conditions in dermatology such as psoriasis and eczema. Although this is not a commercial indoor tanning unit, I do want to talk about the myths of indoor tanning. So myth number one, indoor tanning is safer than the sun. That is not true. In fact, any form of tanning, whether it's indoor tanning or ultraviolet exposure outside, increases your risk for the most common types of skin cancers such as squamous cell and basal cell skin cancer. In fact, before the age of 20, if you use indoor tanning, that increases your risk for melanoma, the deadliest form of skin cancer, by 47%. Myth number two, indoor tanning does not cause you to age more than the sun outside. That's not true. All forms of ultraviolet exposure, whether it's indoor or outdoor, causes you to age. And every time you tan, you're causing DNA damage to your skin. And the more you damage the DNA of your skin, the greater your risk of developing skin cancer. Myth number three, I should get a baseline tan before I go to the beach. That way I won't burn. This is not true. Any form of tanning will give you a burn, and you're still going to burn if you get a tan first. Myth number four, people should do indoor tanning to help them get vitamin D in their bodies. So this is not really true because most of the light that's emitted from indoor tanning bed units emit UVA, ultraviolet A, which in your body does not convert the precursors to vitamin D in your body. So by using indoor tanning, you're pretty much not going to produce vitamin D. So then people say, well, Dr. Vujevich, what about going outside to get your ultraviolet exposure? Because there's ultraviolet A and ultraviolet B outside from the sun. And that is true. And ultraviolet B is what you do need to produce vitamin D in your body. But the way I explain to patients is that if I told you that smoking would cause your body to produce more vitamin D, would you go out and go smoking? No. And we know smoking is a carcinogen. Yes. We know that ultraviolet B radiation is a carcinogen. It's been declared that by the World Health Organization. So I would not tell a patient to go outside to get a carcinogen to produce vitamin D. You can either get vitamin D from supplements or from a good balanced diet. Myth number five, indoor tanning is not addictive. The answer to that is it probably is addictive because when you get ultraviolet exposure, like going out in the sun, you tend to feel good. And that's because it releases endorphins in your body. So we naturally feel good. So when you do go indoor tanning, you can release endorphins, which can, in some studies, lead to addiction.